Sorry guys, I had to go rescue my cat. Back to the video. Patients are at higher risk for cervical damage of the also secondary paralysis. That only happens in about 15% of patients. To go with the spinal cord and everything, me and my sister are actually miracle babies. We were born at 25 and a half weeks. We were 3 months early. One of us, we were like 2 pounds and something at birth, but then an hour later we dropped down to 1 pound 7 ounces and 1 pound 11 ounces. I forget which one, but we were born really early, so we were like could fit in the palm of your hand. We were so small. But to the spinal cord, we do have scoliosis, which we have the sideways one, so it goes side to side. So we do have that. It does give us chronic back pain, and we do hurt sometimes, but we make do. And our scoliosis is starting to cause a couple of problems, so we're hoping to get that fixed soon. So I will update everyone on that when we know more on that. Another thing that is super common with LS is deafness. I do have better hearing actually in my right ear than I do my left. So I'm always putting my earphone in my right ear because I can hear better out of it. But that's because of our middle bones that vibrate in your ears. In ours, they do not move. They don't vibrate like they should. So that causes some of our deafness. And my mom, she does have a worst case of LS, like I've already said earlier on. She is almost completely deaf. She only has like 10% hearing in one ear and like 5 in the other, if that. So she does have hearing aids, and sometimes we have to talk loud for her to hear us, but that's okay. But yeah, deafness is common with Larsen syndrome. But there's technology improving all the time with hospitals and doctors' offices. So there are new techniques that are helping LS patients like myself improve our lifestyle. And I don't want to say cure because there's no cure for it. You have to be born with it. But to help, I guess, manage the symptoms of Larsen syndrome. Also associated with malformations of the middle ear is deafness. That happens in about 21% of individuals. There is softening of our windpipe, the trachea, so we have to keep watch on that. There are heart defects, learning disabilities, breathing problems. I used to have dyslexia. I think I still have it a little bit, but I don't write everything backwards anymore. I have trained myself. It took a lot of years, but I did train myself. And to the heart defects, I have 2 valves that regurgitate. My sister has 4. My mom has 4. Our hearts do sometimes want to act up, and they regurgitate, and sometimes we have chest pains, but luckily it's nothing serious yet. And we do get short of breath a lot, so we always have to stop and rest a lot because our lungs they don't fill up a lot like normal people. And disclaimer guys, I do keep saying normal people because I don't consider myself normal. I consider myself uniquely beautiful, and I do know I'm different. So when I say normal people, I just mean people that don't have LS. Not trying to discriminate anyone or discriminate myself. I'm just putting that out there. Um, all of this, again, is caused by the mutation of the FLNB or chromosome 3 gene. Now I'm going to be talking about the causes of Larsen syndrome. The classic form of LS follows the dominant inheritance gene. Like as I discussed earlier, if your parent has it, obviously you have the dominant gene, and it's usually passed down to the child if you have the dominant gene. The disorders occur when only a single copy of the gene is necessary for appearances of the disease. It can be inherited from either parent. Um, to the inheritance thing, my mom has the dominant gene, and we have the dominant gene. If my niece is born with Larsen syndrome, we will only be the third family in the world to it go down 3 generations, because usually it only goes to like 2 and then it like skips a generation. So we might become famous if my niece is born with it. That might be a good thing because I want to raise awareness to this, but it might not be a good thing at the same time. But it we will only be like the third family in the world with 3 generations that go down with it. So I will update y'all on that as the pregnancy goes along. Because we can't tell yet if she has it. Most of the ultrasounds, they won't tell you if it has it. You almost can't tell a lot of times until the baby is born. So we are hoping that the kid does not have to go through what we do every day. But if it does have it, we will teach it, help it adapt, and get through it together. The passing of the gene from the affected parent, which is the person who has it, is about 50%, as I said earlier, for every pregnancy, regardless of the sex. So it can happen in a boy or a girl, or like us, there was twins and it happened to both of us. The exact function of the flamin B gene, which is the FLNB gene, and how its dysfunction causes symptoms of LS are not yet fully understood. Like I said, a lot of doctors do not know a lot about it. I know a lot of doctors where I live at be like, what is that? Can you tell me what that is? So, and then they end up having to do research on it, or I have to tell them what it is because a lot of them do not know. It is felt that it plays a major role in development of the skeletal system and the joints. Researchers have determined that a few cases of LS may result from somatic mosaicism. I don't know if I'm saying that right. Anyways, in the mosaicism, the mutation of the FLNB gene causing LS occurs after fertilization and is not inherited. And as I said again, the percentage of severity depends on the case, the parent, how bad the parent has it, stuff like that. I know this video is lengthy, guys, so just bear with me a little while longer. Only have a few more cards to go. Now we will be talking about affected populations. LS affects male and female in the same equal numbers, same frequency. It don't happen more in females than males. But personally, on that note, I know more girls or females than I do males that have it. I have met one little boy that has it, but a lot of people I know that have it are females. but that's just who I've met. It occurs in about 1 in 100,000 people. As I said, it is a rare disease. Due to the difficulty in diagnosing LS, determining its true frequency is difficult. With that being said, we are now finding over the years, especially because of the groups I'm in on Facebook and stuff like that, there are a lot more people that's actually turning up to have LS, and that was misdiagnosed because back then they didn't know what it was. They didn't know what to call it, stuff like that. So there are cases showing up now that what they're thinking to be misdiagnosed. Dr. Larsen is the one who came up with the name LS in 1950. It was named after him. I don't know a lot about him, but I will research more information on all this to make sure I had everything right and correct, or if I missed anything. The diagnosis of LS is based on clinical evaluations, the patient history, and the radiological findings like X-rays, MRIs, stuff like that. Some cases can be diagnosed in pregnancy through tests, but as I said, a lot of people don't know their kid has it until they are born. Like my mom, when she had ultrasounds of us, our ultrasounds looked fine, but then when we were born, they noticed that we had it, and then we got diagnosed with it, so they didn't know until we were born. And in pregnancy of LS patients, it is highly recommended that they get a cesarean because due to our skeletal abnormalities, our hips cannot spread very far or far enough to have a kid naturally. So like my niece will be born through a cesarean. My mom had a cesarean. So it is highly recommended due to the hips and everything like that, and it's just safer with LS patients having so many problems as it is. They can be watched easier, monitored. So if something does go wrong, you're already in surgery, so they can treat you right there. Now, if an LS patient is pregnant and their child is not suspected to have LS, then more than likely there is a chance you can have it naturally, but it is still highly recommended whether or not your kid you think is going to have it or not. So that is all the flashcards I have today. Like I said, if you have any questions or if I talk too fast or if you didn't catch something, please feel free to text me on Facebook if you're on my Facebook. Find me on Instagram and you can message me on there, or you can post some comments on this and some questions if you'll have them. If you enjoyed this video, please give it a thumbs up, a like, subscribe, share. I know it was a lot of information, but if y'all do want to research it, it is Larsen and then syndrome, Syndrome. If y'all would like to, please feel free to research that. That's what I did before making this video, because I didn't know all the facts about it, and there's still a lot I don't know, so I am still researching it and learning more new things myself. But I will try to answer any questions I can, and if I don't know the answers, I will get with my mom and get back with everybody. So if you like the video, give it a like. See you on my next video.